Hello everyone, this is Dr. Khan, Executive Plastic Surgery. So a pleasure to be on again on the 20th of January 2025. Today is a big day. We have the MLK Day, we have the inauguration, and I will tell you, if you ask me, most importantly, we have our patient here who is from Austria. She is post-op day number 5. We're going to have her talk, we're going to have her listen from her experience, what is it that she went through that had her come here so that she could basically get the relief that she was very much looking for. So you are 37, correct?
Yes.
And you got implants in 2017.
Yes.
And then you started to hurt.
Yes.
Now, what is it that you went through that led to your explant in 2022?
I immediately had the impression that something does not feel right. Something is wrong. It was that much shortly after the implantation, I think 3 months, that I first started with a doctor, and I said, I feel tired, I don't feel like myself anymore, what is wrong? And they said, no, are you stressed, psychological, go to a make some psychotherapy, and the symptoms got more and more, and always more and more mysterious, like burning in the legs and infections that got chronic, like sinusitis on the left side, only on the left side. And I even did the operation to clean the clavicle, and it grew again, and another operation, and it grew again. It was all very mysterious because I was a healthy person before, and suddenly I was getting sicker each day, and in the end I could not get out of the bed anymore. I felt so sick and heavy and old, like 100 years old.
Mm-hmm. So in January of 2022, you got an explant.
Yes.
That is removal of the implant and the capsule.
Mm-hmm.
Now, what is interesting is you and I talked many months ago, earlier in 2024, and we did the phone consultation, and I saw pictures and videos, I saw pictures, not the video. I saw the picture where you had what is a complete capsule removal, from what I saw. Now, there was no name associated with that, but putting the two and two together, it looked as if you had gotten your surgery that you were looking for, like the end block, correct?
You are very right, thank you, Dr. Khan, because this was very mysterious to me too, because the photos looked fine. It looked like it was an okay job, and I thought maybe it's my fault, maybe I have to do more detox, try harder, and still something inside me said something does not feel right. Something does not feel right. And until this day, I'm not sure what it is about this operation that went wrong, if the pictures were maybe, I don't know, faked, or I think the main point is that nobody talks about the inflamed tissue.
Right. So this is very important, what you're mentioning. So whenever a surgeon removes the implant and the capsule, and especially when you have the implant, the surgeon must, out of professionalism and completeness sake, should write down the name of, the date of the surgery, the initials. So if the patient has initials AR, for example, this is, again, no HIPAA violation. And those pictures, and very important, it's not only the pictures, but the video of cutting open of that capsule must be done, because that way you can see exactly what and how the surgery was done. But looking at your pictures, that was reassuring, to the point where I told you, you were on the schedule, and I told you we're going to go ahead and cancel you because I'm not convinced that you are going to be the right candidate, and you may have another underlying etiology for your problems. Because looking at those pictures, I was not convinced that I was going to be able to give you the relief. And whenever you're sitting on the fence, I tell my patients, and I talk to my patients wholeheartedly, directly myself. My team does not talk. I talk to my patients because I want to go ahead and screen you. So we took you off the schedule and we gave that day to someone else. Now, what you said is very important, that it's not only the implant capsule, but the inflammation around. that needed to be very much removed. And you know what gave me more confidence was one of your friends. She had sought the same surgeon back home in Europe, and she had the same symptoms and she improved. And because she improved, it gave me the confidence that I would be able to give you the relief. Now please go ahead and tell us, after your 2022, January 2022 explant, how did you improve?
Well, I was relieved that the implants were gone. So one symptom I had was I felt like dying, and this symptom was less, thanks God, but I had a very strong reaction, like infection of the throat that lasted half a year, and I still had this feeling that something was not finished, something does not feel right, and it's, like you said, it was a tricky situation because the pictures look good. And then I remember exactly the day when my friend Sarah, she sent me a reel of you where you said the implant must be removed, the capsule and all inflamed tissue. And this clicked in me, and I thought, oh, nobody's talking about this inflamed tissue. And so I thought, maybe there's still something to do. Maybe I can still be saved. Maybe it's not about me. Because I tried so hard to get healthy again. I spent 10,000 of euros. I did the plasma cleaning, blood washing. I'm not working anymore. I'm not having any stress. I'm meditating, eating healthy. Nobody eats healthy like me, I think. I did everything for years. And I still felt like that this is not, there's something going on inside me. I don't feel right. And after the operation, I felt like I didn't feel ever before, like really energetic and more awake, I don't know. So.
Sure. Now you're just 5 days out. I saw you a couple of days ago in clinic on Friday, and you had said there is a big difference between before and after. Now remember, you're just 5 days out. Now what we want to do is, this is very important. Now we have you, and we have your 3 other friends who also came, who explanted, one from Switzerland, another one from, I believe, from Italy, another one from Germany. And you're all a network of friends, residual capsules. And this is where you have sought the surgeons out.
Yes.
These are good surgeons. But remember, the take-home message for this is the implant must be removed, that capsule must be removed, and like you very well said, that inflamed tissue around harbors in it the toxicity as well, that silicone or whatever it is, that must be removed. It looks abnormal to me, it feels, palpates abnormal, my sixth sense says it is abnormal. I remove it, and this is what I did. And you have the pictures and the high definition videos that Caitlin, my nurse, took from the operating room that clearly shows that scar tissue, inflamed tissue, that residual, whatever inflamed tissue was removed, because you already got supposedly your, the explant with the end block, from what at least I see in what are those reassuring pictures, and that is the take-home message. And that now what we want to do here is, this is very important, because we have to see where you are at post-op day 5, but we have to see where you're going to be at 5 months out, 1 year out, 1.5 years out. At the end of this month, in 10 days, we have an interview with another patient, a friend of yours, who is going to be 6 months out from her residual capsules. So she had her explant done and supposedly end block, and she did not improve. Then she sought out another surgeon to do residual capsules, and still she did not improve. Now this was very tricky, because now my surgery was the 3rd surgery with her, and you're going to hear directly from her. And then when I did operate on her, we're going to hear from her about her improvement. So it is the inflamed tissue around that must be removed, and that must be sent to pathology. And there is complete removal of all inflamed tissue. It is a tricky situation, especially in your case where you have a low BMI and you have below the muscle what is a lot of inflamed tissue directly on top of the rib. And given the nature of the surgery that I did, the fascia of the intercostal muscle, the fascia of the pectoralis minor, the fascia of the serratus anterior, the periosteum, the perichondrium was removed completely, sincerely, wholeheartedly, definitively, religiously, honestly, such that now as you and I sit, you have the pictures and the videos with your name, and you have the confidence that as you go back home, back to Austria, that all of it was removed, and we'll continue to hear from you. Now, let me ask you this: how was your pain post-op?
I was very fortunate. I had no pain at all. It was much better than I anticipated, because I read that sometimes can happen that patients have strong pain, or I was counting on having some pain or strong pain, because it's a sensitive area where nerves are going, because I was scared, and I was really surprised, positively surprised, that I had no pain at all, like zero.
Zero, yeah. And you know what? We're blessed. Did you end up getting the Exparel or no?
Nothing.
Okay, yeah. So no Exparel, and this is where the interesting to note. But this is basically how not only you but a lot of patients have been in the past, where they take a Tylenol. They're a little bit more sore than usual, but they do not have much of pain. Now, how was your I also removed the scar, because you had what was a lollipop anchor incision, so I removed the scar, so now you have one defined scar that's going to hide, that hides nicely in the crease, so I revised that, and I'm overall very happy how everything went. Now, how was your anesthesia experience?
Well, would be too much to say that it was fun. It was not, but it was much lighter than general anesthesia, and was a big argument for me to come to America, because to make a residual capsule operation with general anesthesia that lasts several hours, I wouldn't be confident that I would survive it or take it that well. And when I heard that you are a twilight anesthesia, I thought this is a big argument for me to come, and it was much lighter.
No, we're very blessed to have our team, the CRNAs that we have, truly outstanding. They deliver very optimal, precise, practical anesthesia, and to date not a single patient has had any recollection of the surgery, which is the IV general, a deep sedation. You clearly did not need drains. You clearly did not need a lift. No. Twilight anesthesia. The capsules went to pathology. Pathology was reassuring. Number 4, you have the high definition pictures and videos of not only the chest, but also the capsules that I did the Facebook Live on. You also have the microbiology cultures, and this is where you have the confidence that everything was done. Do you want to say anything? And as we close, we definitely want to hear from you. I'll put you on the spot, and we'll say sometime in June. We will have you kind of follow up with another Facebook Live. Our only intent and purpose here is to raise awareness, to say, you were hurting. Look, I did not want to at one time even operate on you, correct? And we canceled. We decided that it was going to be best to delay the surgery, because we want to exhaust all other non-surgical avenues. And you did everything wholeheartedly. You have a whole life ahead of you. And, we want to send the message across, at least in my practice. You want to do the surgery once, you want to do it correctly, you want to do it definitively, you want to do your homework before you choose your surgeon, and you want to have that proof back, such that when the surgery is done, that you know that your surgeon did exactly what was discussed, and that you have that proof with the high definition pictures and videos of the chest wall showing complete removal of the capsule, and also on the table cutting open of the implant capsule, so that you are not second guessing yourself. I always like to say this very importantly and humbly, your case situation was the worst case situation. Meaning in a sense, you already gone through the explant, and from 2022 till now, you have not improved. And the other thing I just want to mention here, the ladies know from their heart that they did not get the right surgery. And this has happened many times before, where the patient sought a surgeon out who in their mind believed that they could do the surgery. And when the going got tough, they cauterized the capsule. They did not remove it completely. They thought that they were doing the patient good. They were not putting the patient's life at risk. And deep down within, ultimately, you will see that the patient did not benefit because now she had to seek another surgeon out, make the travels, and then go through the whole process of getting the surgery done and doing it completely after already having gone. So you've kind of, if you will, the kind of the worst case scenario, if you will. And we want to go ahead and send the message across. You know, one of the patients that I talked to, and I'll end with this and I'll let you finish. One of the patients asked me, have you ever gone in and not found anything? And I say, I screen my patients and I look at the pictures, so I see that the length of the surgery was an hour, hour and a half. That convinces me it was not the correct surgery, because in my hands it takes me 4 hours. So if an incision is 2-3 centimeters, I know the end block could not have been done, or 4 or 5 centimeters and the implant was 650 cc's, you know that the patient did not get the complete total capsule removal. Number 3, the implants were not returned to the patient. I find that that's another very important piece of evidence that the patient must have, so that she or he knows that the implant was not ruptured on the way out, it was not damaged. Number 4, you want to get the high definition pictures and videos. And number 5, you want to have a clear track record of the surgeon online, social media, that gives you that confidence that that surgeon is authenticated, has been gone through the tests of the previous patients, who only are convinced that that the surgeon is going to do the right surgery. If a surgeon is augmenting, that basically nullifies or basically takes the steam away, that the surgeon is a believer of breast implant illness. In 2025, either you are augmenting and believing in augmentation, or you are an explant surgeon and you're only explanting and you're actively on social media talking against what is breast implant illness, because that's ultimately not fair for the many ladies who are going through the hurt. Now, please, if you can, any take-home message, anything you want to tell our listeners or your friends who are listening?
Dear ladies who are in a tricky situation, don't give up. And it's coming down to believing in your body, in your BII, because I think that we experience BII in a very clear way. It's like a paradox. If the outside world says you are healthy, and you experience an illness each and every day, so either you are right or the outside world is right. And there comes the moment to say, no, my gut feeling has meaning too, and I don't want to give up, especially BI. You get maybe some burning in the chest in the end, or you have gut issues, and you have got neurological issues that you did not have before. And in this situation, there is still something to do, even if the outside says there's nothing to do. And I'm very happy and infinitely grateful that I got here, that I got so much bad stuff out in the end. Maybe not all of it is capsule, much stuff of it was inflamed, unhealthy tissue, but seems like it's much better that it's out. I feel like I've never felt before the last 7 years. So that's my point.
No, thank you. That was very strong. You listen to your gut. Your gut is never wrong. That has, God has instilled in us, and you follow your heart and your gut. Your gut is always going to be right. Thanks. And we will hear from you, and we'll continue to follow you. And in June of 2025, in 6 months, we will certainly do a follow-up, just like we have done with the other patients, so that we can continue to see how you're going to continue to progress and improve. Thank you very much. Thanks for sharing your journey. I must mention, initially you were saying your English is not good. I have to say you communicate very effectively, and you certainly did get the message across. And I will tell you, I cannot talk like you can, because you spoke from your heart. Yeah.
Thank you, Dr. Khan.
Yeah.
Thank you.
All right. Okay. Thanks.